Good morning, everyone, and welcome to our webinar, Data-Driven Decision-Making for Prevention, Planning, and Implementation. This is part one of a two-part series. Just a quick reminder, the webinar format today will be recorded and available for viewing along with the PowerPoint slides on our, on the Great Lakes Prevention website. Today's audio will be broadcast through the computer speakers, so make sure your speakers are turned on and up, and there will be no call-in available. You may use the chat box feature throughout the webinar to ask questions or to add comments, and a Q&A session will be held after the presentation. We are happy to have our two speakers today, Kyle Barrington and Erin Ficker. Just a quick introduction. Kyle Barrington has 30 years of experience in the field of substance abuse, prevention, and treatment. His experiences include being a substance abuse counselor, director of a dual diagnosis hospital unit for adults and youth, director of an emergency shelter for runaway and homeless youth, and an evaluator for local and statewide organizations. Dr. Barrington has extensive experience evaluating the impact of alcohol and drug abuse prevention programs and practices. He has 5 published peer-reviewed articles and has been quoted in several scholarly articles and has conducted over 200 program evaluations. Erin Ficker serves as the prevention manager for the Great Lakes Prevention Technology Transfer Center and has extensive experience working with community-based prevention providers. She also has experience in quality and process improvement coaching and training. So thank you very much, and I will turn it over to our speakers.
Thank you so much, Anne, for that introduction. And thank you all for being here today to talk about data-driven decision-making in prevention. And not just being here today, but being here next week as well. I'm Erin Ficker, the prevention manager, one of the prevention managers at the Great Lakes PCTC, and I'm really excited to be here with you today. So thanks everyone for being here. We do have a poll, and you may have seen it earlier, and we'll pull it back up. And we're just asking you, when you think about data in your work, how do you feel? Do you feel invigorated or confident, like okay, I guess, or nervous, or though there are some of us who, may actually feel nauseous at just the thought of collecting and looking at data, and that's okay. That's absolutely okay. I know I, for one, feel like sometimes I fall into multiple categories or different parts of this, and we'll ask this again later after we go through our second webinar. But today, as you sit down to talk about data, how does it make you feel? And we have a lot in the middle, a lot of, okay, I guess, which is fine. That's a great place to be. We have people who are invigorated and confident, and we're so glad you are here. Those of you who feel good about data and like the idea of working with data, please feel free to add your comments or insights and share in the chat as we move through the webinar. Kyle's going to bring us lots of great information and share with us about his experience, but also we want to hear from you, so that this kind of unique group we have that has a variety of kind of all the way from nervous to invigorated, no one's nauseous yet, which is good, I guess, we'll love to hear from you. So if anyone else wants to vote, you can do that for just another minute, but it looks like we have a solid grouping of okay, I guess, through invigorated, and a couple of brave souls who are not afraid to say they're nervous. So thanks for being here, and hopefully Kyle and I can help move you up towards confident. Okay, well, we are going to go ahead and get started. Great. So our agenda today for session 1 is we're going to define what we mean by this data-driven decision-making. Where do we go to find data? And how do we assess the gaps? What are we missing? How do we know what's missing? And then we'll talk about identifying, interpreting, and analyzing our local data. So that'll be for session 1. And then we really do see this as a 2-part session. So we do hope that you come back and join us next week, where we'll continue this conversation and we'll start talking about using data to identify strategies, determining what we call best fit, talking about adaptation and fidelity. How do you do that and use data for those changes and programming? And then we'll also be talking about linking data with best fit. So all really important conversations about how we use data, and that'll continue in session 2. And those are our agendas for today and tomorrow. Anne gave a great introduction to Kyle. He is absolutely an expert and one of the people I turn to always when it comes to data and evaluation. So I'm so glad he agreed to be with us and share his expertise with us here today. I'm someone who comes from a long background in evaluation, but I still always need an expert, as we all do. So Kyle is the guy I turn to, and I'm excited that he's here with us today. So I'm going to turn it over to him without any further ado, and I'll be jumping back in when we have questions or comments. But please, as we move through, feel free to type in the chat, ask questions of Kyle, and share your experience. And we're going to just have a great time today. So I'm going to turn it over to Kyle.
Well, thank you very much, Erin. I truly appreciate both Anne and your introduction. It is always kind of anticlimactic to have that picture stand there in front of you, so I apologize to everybody on the call in reference to that big old picture of my head. My kids, when they saw that, were absolutely beside themselves that that was actually going to be in a slideshow. So they think I'm just the nerd that sits behind a computer screen and crunches numbers. Anyway, it is great to be here today. I hope and trust everybody. It looks like we have somewhere in the neighborhood of about 45 or so participants at this point sitting down on a Tuesday morning in the middle of July, or I guess early part, but into July, and listening about data. And so that makes my heart very happy as we turn to this idea that more and more people are becoming more interested in data and how data can make prevention feel better. From a history of over 30 years of experience with prevention, I can tell you when I first started, the first data set I received was actual statements from teachers and administrators and others in the community who said, yeah, we think we like it. That was it. That was the data that we received after spending hundreds of thousands of dollars back in the 80s and 90s trying to reduce substance abuse, and we got statements that says it was effective because adults and people in the community said they thought they liked it. And that always intrigued me, that all that money was going to something that people thought and thought about but didn't have the data to support. And I began to think, where else would you allow this to happen? Where else in our lives would we go to like a car dealership or a car repair place and say, yeah, I need my tires replaced? And they say, yeah, I think I'm going to be able to do that. I want to know, yes, you can do it, how long it's going to take, what the price is going to be, that the specifications of the tires are going to be what I need for my car. I need it to be specific to my needs, not just an idea that somebody thought they could do. So that became the process of where I started doing some evaluation work in the 80s, and here we are today. So one of the things that's important to note that if I was sitting in this group and I was one of the 45, 47 people on this call at the moment, where are we trying to get you to? And there's objectives and stuff, and there's terminology that we have to put in slides to make sure that we meet a roadmap, but really here's what I want. At the end of this, I want you to be able to walk away from the 3 hours you're going to invest between today and next week and be able to say, I can use that. And if you can walk away saying, hey, that is something I didn't think about, or I didn't think about in that way, and I'm going to try to use that, whatever that is, then this has been a good investment of our time. So as we move through this process, as Erin has already indicated, there are a lot of people who are invigorated about data, just like I am. There are quite a few others who are okay with it. And of course, there are always some people that look at data and get a little nauseous, and a lot of people in my world are the same way. My kids are the same. And my wife sometimes gets a befuddled look on her face when I start crunching numbers. But when we start doing objectives, it's important to note that we do have a roadmap for the next 3 hours. First and foremost, I'm not going to read the exact slide, but we're going to make sure that we understand that everything's linked back to the strategic prevention framework. We're going to move and identify, interpret, and analyze local data. We're going to use local data to inform our planning and implementation. When we find out that we don't have all the data we need to look and search for strategies and pieces of data so that we can better address those priority risk factors and protective factors. And then we want to know how they kind of plug into a logic model and how a logic model can actually help with your implementation. So that's kind of the goal. But again, at the end of all this, if you can walk away and say, hey, I can use that, then we did well. So as we move through it, let's start this process. One of the things that's always intriguing to me is that people in our field, and particularly those outside of our field, still think that prevention has always been using data, and that data is something that we do naturally. And in the last 10 to 15 years or so, we've done a much better job of doing data and data collection. But as we mentioned before, a lot of cases, data that we use actually came from just assumptions and claims. And a lot of people are struggling with this concept that we actually have had mental health concerns long before we had iPhones. It seems to me every time I'm turning around, it seems there's a connection between mental health concerns, particularly in adolescence, and connectivity and the digital age and iPhones. But we've actually had issues with substance abuse and mental health long before we had technology. But we have always, as a humankind, attempted to address it. First and foremost, if you go back even to the caveman days and cave women days, one of the things that we understand is that we had mental health. And we saw this in the scripture, the scribes on the wall, and we also saw it through the bones and the relics that archaeologists have actually uncovered. And one of the first things that you can think about is if you are a hunter and gatherer and you collected fruits and berries and you took those into your cave, which is cold and damp and musty, and you left them there for a summer, you kind of have a fermentation going on, a very crude one, but a fermentation process none the same. And you can imagine somebody going down there and seeing this oozing liquid fermented process and tasting it some more and eventually coming out in an altered state. And that's exactly what some of the drawings depicted. And in those days, the way they took on the challenge of dealing with people who had substance abuse issues, even during the cave periods when we lived in caves, was through a process called trephining. And trephining was literally just a process of cutting a hole through the scalp and in through the skull to release whatever spirit was possessing them to cause them to act differently. And that process, formed out of cutting a hole through, while we lived in caves, eventually continued until the 19th century, where we created really neat weapons, is what I use it and call it, to drill into into the head of people with mental health issues to be able to start treating them. That was our definition of data. So when we look at the slide, the one thing that I always want to impress upon people is do not believe that the data we have today comes from a long history of data collection. We have a long history with mental health and substance abuse of believing something worked, like cutting a hole in someone's head. The interesting thing, both when we lived in caves and even this unfortunate individual that had the 3 trephinings in their skull, is they live long after the infliction of this kind of treatment. Well, that takes us then into the somewhat quote-unquote modern age. And one of the things that occurs is that we used to have data, and the data was basically, it's better for me. And if you think about it, if you can read a little bit of French, the 2 children there with a sign that says for sale above their head was really that. It was a statement where we were believed that it was best for children, that if you didn't want them, is to sell them. And the concept was if somebody had money to pay for them, then they had money to take care of them. Well, we know through a whole history of data, child abuse data, parenting data, stress data, all those kinds of data that we have now that says generally selling people, regardless, is not a positive outcome for the individual sold. The other thing then is the slide to the right is our famous slide that comes out of the quote-unquote Wild West, where we have children's cough syrup that was made out of alcohol, cannabis, chloroform, and morphine. I can tell you right now that if I gave that combination to my kids, they would not be coughing. And depending on how much they gave them, they may not even be breathing. But that was the data, and the data The data was really the process of being able to say, hey, it worked, but we didn't understand how it worked and what the consequences were. So as we go through this process, I really want to implore upon everybody on the call is to understand that the idea that we use data is new. The idea that we can sit back and have evidence-based practices that are truly based on data and not hearsay is a novel approach and something that is new basically to our generation in our lifetime. So as we go through this, all the young people on this call who are starting to get into this field do know that the value you bring is based on a short history of data. And so as we go through it, the field is wide open for better data collectors, better evaluators, and better interpretation of the data as we go forward. So as we go through it, then it's important to understand then it, sure.
Oh, sorry, I just want to jump in. I love those examples, and one of the things you said that I think is so important is it's not just what we do, but why does it work? Did it work, and why does it work? It's such an important question that you raised in that last slide, so I just think that's a wonderful frame. So thank you for helping us understand why we look at data.
Oh, very good. Well, I appreciate that very much, Erin. And definitely one of the things that we do know is we're getting better at being able to say how it works. And a lot of that comes through our logic modeling. And then the flip side of that is having the data to support it. So, and we'll try to ring that true several places throughout this presentation. As we move, though, from the idea that we used to not have really good data, one of the things that occurs is this idea of data-driven decision-making. And a lot of people shrug their heads, and when I do face-to-face trainings or instructor-led trainings, one of the things that's important that I always see in the audience is people look at this and you can just actually see the kind of deflation in some people when we start talking about data-driven decision-making because they believe it to be complex. But let me explain that everybody who has ever been on a date, anyone who has ever been in a relationship and married, goes through data-driven decision-making every single day. You, on your first date, or even when you were attempting to ask out the person you wanted to ask out, you had to understand who they were, what they liked, what they disliked, where they might like to go. Those are all data. And in order to get the person to say yes, you have to have some processes in place. When you're raising kids now, we do the same thing. We sit back and we go by an idea that says, yeah, it's probably not best to let our kids just decide when they want to get up on a school day. It's probably good to use data to inform our decision making around that they need to eat a balanced diet and not one that's just full of sugar. So we're starting to use data in a day-to-day operation. And if you don't believe me, and you aren't convinced about that whole dating thing, maybe for you it just happened, you knocked into one another, and you got married the next day, and everything is blissful. That's great. It took me 3 times to ask out my wife. The first 2 times she said no. Each time I went back and got additional data to try to figure out what might be the impediment. I started doing focus groups, if you will, and key informant interviews with people around her to collect additional data to try to figure out how I could ask her out in a better way. And so as you go through these processes, just as humans, we use data, but go to a grocery store and go to the produce section, and you will find people using all sorts of different information to make data-driven decision-making about whether or not a plum is ripe, or even more recently, avocados are ripe. You got people flicking them, you got people smelling them. I even saw people there twirling them, and every one of them, when I asked, would tell me that they had learned that one way or the other, depending on the way it spun, or the way it smelled, or the way the sound when it flicked, made them understand that that was the best decision in regards to whether or not to purchase that particular produce. So we do it every day. So don't get caught up in the idea of what it is. Know that you already are doing it. If you go to a coffee shop and you don't like the coffee, and that it becomes part of your data-driven decision-making. So in essence, what data-driven decision-making involves is it takes us away from making an assumption about whether or not something is working or is something that we like or should do, and we start putting some structure around it. And basically, claims are made when we don't have data are made, but in many cases when we start having data, we cannot support the claim. So data-driven decision-making involves making decisions that are backed up by hard data rather than making decisions that are intuitive or based on observations alone. And one of the good cases of that was the DARE program back in the 80s and the 90s, drug abuse resistance education. It was designed to reduce substance use in teens and middle school students. It was taught by police officers. And one of the things that we always believed is that it was highly effective until we started assessing the data. And we found out that it was really good about improving relationships with police officers, but not good at all for what it was designed to do, which was to reduce substance abuse. Now, we could argue that we need a DARE-type program back today to increase community support around law enforcement. True, but we need to package it as that, not say that it was something that we could not support. So again, even our brief history, even in the last 30 years or so, we've had assumptions dictate decisions as opposed to data. And really what we're trying to say with data-driven decision-making is that we want to put data first. Is this what we need? Right? You're not going to go to, if you have a Ford truck and you have a specific set of tires, you're not going to go and get a different set of tires that aren't made for your truck. You're using data. We need to do the same thing in prevention field. So as we go through the process then is how do we start putting data around our work? Well, there's a couple of things to note about how we start doing data-driven decision-making. Number one is we have to have key indicators. We got to be able to analyze the data. We have to have some established prevention priorities. We need to allocate resources, and that is a big one, and we'll talk a little bit about how we can do that later on in the presentation, and particularly next week. And we have to develop a systematic ongoing monitoring process to track progress. Now, people always kind of, again, shrug their head and say, well, that's a lot of work. We do it every day. I cannot imagine anybody who is a parent who hasn't had a sick child. And when my children were younger, every one of them, we had chronic ear infections. And those chronic ear infections, one of the things that we understood is that once we identified that it was an infection that could be treated by antibiotics, they needed to complete their entire antibiotic. In my first child, antibiotics worked perfect. That's because we tracked her. We tracked her fever, we tracked her attitude, we tracked how she felt, and we looked at her to make sure that she wasn't pulling on her ears. There are all sorts of key indicators. We collected and analyzed that data. We used that data to make decisions about whether or not we need to go back to the doctor or change up a process. So we had all these pieces in place, and we did it without ever thinking that that was data-driven decision-making. Then we had a second child. The second child had even more ear infections. And unfortunately, the first time we gave her the same antibiotic that worked for my first and oldest child, it didn't work for her. And we monitored, and we saw that she kept pulling on her ear, and the fever didn't break. So we had to take her back and found out that for her, that medication wasn't appropriate, and they needed to use a different kind of antibiotic. So as we go through it, that is a primitive example of how we use data to drive decision-making, in that it is not something that you had to learn. It's something you know intuitively. And that if you get a prescription and it says take this pill 3 times a day for the next 10 days, and you only take it 1 time a day every other day, your results are going to be different. And as we go through this process, one of the things we'll start talking about is making sure that we follow through with our data-driven decision-making with fidelity. So those are characteristics of data-driven decision-making. These are things that you already do. You go to a hamburger joint, if you don't like it, you're making a data-driven decision. If you return an item that doesn't fit, you're doing the same thing. So we just want to make sure that we take what you do naturally and put some context around it so we can do it professionally. So that takes us then into the data-driven decision-making in the SBF. And it's important to note that we use data across the entire SPIF SIG and the entire SPIF. And a lot of grantees who get the SPIF SIG continue to do this today. If you are a grantee or have funding and you're not using the Strategic Prevention Framework, I think you should. It is a well-recognized, it is an evidence-based practice unto itself about how to use data and how to get programs implemented in communities. So as we go through this process, we're always going to kind of come back to this to understand where data-driven decision-making occurs. But just as an example of where it occurs in the SPF, we'll take a look at assessment real quick. And that is when we go into a community, or you walk into a community in your community and you say, hey, we need X, you need to know that X is based on data. And usually that data is going to come from a needs assessment, resources and readiness assessments, addressing any gaps that you have found in order to make sure X is the best solution in your community. X could be a curriculum, it could be an environmental strategy such as a social host ordinance, or it can be other processes in your community like trying to reduce substance abuse or trying to reduce suicide. All of them start with an assessment of what's going on in your community. We do that with the SPIF through the capacity building as well. Do I have the capacity? Do I have the staff? Do I have the resources? The planning, what's it going to look like? Do we have the ability to do this? Do we have the institutional capacity, the computers, the equipment, the knowledge? Once we start implementing, is it going right? That then folds us into the evaluation. What does it tell us? That sends us back into the assessment process. Are we doing it the best way we can? All understanding that we need to make sure it's sustainable and that we address cultural competence, particularly in communities that may not resemble different sides of the communities, or different parts of communities may not resemble each other. A one-size-fits-all does not apply. So that's how we start this process. And when we start going through it, everybody should be fairly familiar with this idea that we are using the SPIF to collect data and to make data-driven decisions. And it's important that we know we do that throughout the entire SPIF process. So what data to collect? So as we go through this process, well, that first and foremost is going to depend on what you're trying to do. And if you are trying to ask somebody out on a date, then the date that you're going to collect is different. But if we start talking about substance abuse and community needs and mental health and non-medical use of prescription drugs, then we need to understand what your overall goals are, what questions you're trying to answer, and who is the audience of your findings. So once I get this data, who am I presenting it to? So one of the things that occurs in this process, of course, is the most important one is our goals. And that is we want to make sure that we understand, are we trying to reduce something, increase something? Are we trying to make a change? Are we trying to positively impact a protective factor, or are we trying to reduce a risk factor or mitigate a risk factor? And then as we go through that, once we know the goals, what particular questions are we trying to answer? Are we trying to get what is the best solution? What is the best approach? How to raise the most of the money to address it? How to leverage additional resources? It could also be, how do I get the data I need to answer the question? And that is a question unto itself, and we're going to get into that later today. And then finally, you have this data, and now you're going to publish it or present it. You have to know who your audience is. How you present to different groups, you use the same data, but you can present it in a different way. We have that, as we talk about later today, between quantitative and qualitative. A lot of cases, audiences will want qualitative data, the stories behind the data. In other cases, you'll have number crunchers who want data that is absent of the story. They just want to know, did it increase or decrease? And then you'll have a mix of people who want both. So as we go through this process, it's important to note how and what to collect. An example of this is a couple of years ago, we were talking with a group in school, and there was a community representative on it that wanted to understand what were the best protective factors for kids in their school. So the goal of our process was identify the best protective factor for a reduction of substance use. The questions we needed to ask were questions around what protective factor groupings did children get exposed to and in what quantity that resulted in a decrease. And it turned out the audience for our group was that community coalition. And when we presented our findings, we found out real quickly that another audience group was fascinated by the results and wanted even more data. And what we determined in this community for substance abuse was it was church affiliation. The number of kids, and the tipping point there was 2 or more hours a week. So an hour of church, and then if they went to a youth group afterwards or a youth event afterwards involved with their church, then that was a key process protective factor for students in regards to their reporting of substance use. And then as we presented it out loud, we talked about football, we talked about extracurricular activities, church involvement, community involvement, and other factors. And then we shifted when we got the specific request to present data specific to the church when the church groups wanted to get involved. The good news now is that the church groups have created programs and funding to provide an additional hour during Wednesday's after-school program for kids to come in and learn more just about the things that the church does, church administration, church, those kinds of things. And it is non-sectarian, all the church groups are there, but it is interesting to note that that was one community's approach when they started collecting data. So that takes us then into, if you know that you need to collect data, where do we find the data? Now, we all have great examples, I am sure, of where we find data, what to get from the data, and where we go to get our common data sets. And if I were to ask you right now to, if somebody would in the chat box down below, just type in, give me one data source that you would go to. And what I'm looking for in particular is trying to identify if anybody has a specific resource they generally always go to. And we've got several people typing, so we will wait for a few of those responses to come through. Indiana Youth Survey, very good. State YRBS, Survey and Focus Groups, YRBS again, yep, youth surveys. National Safety for Adolescent and to Adult Health, very good. National Study, sorry. Yep, very good. So as we go through this process, we have the Indiana Youth Surveys, National College Health Association data, Monitoring the Future, very good. County Health Rankings, that's correct. There's a couple of resources now out there that ranks your county in regards to a lot of these health factors, including mental health days, positive and negative. Michigan Profile for Healthy Youth, Treatment Episode Data Sets, NIDA. Excellent. This is definitely, Erin, I would say a group that is informed about data sources. Very good. Online Data Platform.
Yeah, absolutely. These are guys who are, I think, on that higher end of data comfortability. Absolutely.
Absolutely.
Look at all those.
And that makes me very, very pleased. So as we go through this process, then we have all sorts of places where we can go and collect data. Now, some of you are going to be in communities where you may not have access to this data, or you're going to be in communities where the school district doesn't want to participate in different surveys and different survey groups, or in asking all questions, and you may even get where they want to have that data, but students don't report in the capacity or in the volume that you need. So as we go through that process, we'll start talking a little bit about that piece. But as we've already mentioned then, is already exampled by several exceptional responses to that question. We have the following and existing data sources almost always are going to save you time. So if you know that you have an Indiana Youth Survey, then you definitely want to start there if you're looking for youth data and data trends. You also want to make sure that you get data that is not just a single point in time. You're looking for trends so that you can look across comparison. So if I tell you that 15% of high schoolers report using alcohol in the past 30 days, that's a piece of data. But it doesn't tell you the story of what's happening in your community. Is it going up? Is it going down? Is that 15% across all subgroups and subpopulations? Is it the same for male and female? So as you go through the process, remember that when you start looking at data, you want to make sure that you have the data sources that enable you to make trend data. You also want to make sure that the data is actually specific to as close to the local population as possible. One of the things that if you ever get a chance and you want to see data in action, both good and bad, the uses of data, or less effective uses of data, become a grant reviewer. If you've ever reviewed a grant, you can quickly realize those people who have local data and those people who don't. A couple of months ago, I was on a federal review panel, just the normal process of reviewing grant applications that come through. And several of the applications had very localized data. They wanted to break their or use funds for a very specific subset of their city, and they even had census tract codes in place, and they had data specific to that, including student use data. Other applications were strong, with the exception that their data was either countywide or national data or state data, when they were also trying to be specific to a city. And the issue is, if you're going to be a grant reviewer and you're allocating potentially taxpayers' dollars, do you really want to fund a program that can't get their local data, or do you want to fund a similar program that already has that local data and already has the capacity to collect it? And then also we want to make sure that we look at data sources, because data sources can also help build our sustainability for prevention. So as we go through this process, if we have data and we can show trends and we can show that after X, the implementation of our program or services, then we have a reduction or an increase in the protective factor or a decrease in the negative effects of a risk factor, then we have the possibility of sustainability. Excellent use of all those resources, but again, you want to start with existing data sources. And how to begin? Well, the first thing we need to do is you want to make sure that you develop an inventory of the data you already have. Now, if you are not already the grant writer for your organization, then you want to find out who is. And I know some of your organizations may not have grant writers, but if you do, you want to find out where that person resides, where their office is, and you want to get to be really good friends with that person. Usually grant writers, people who deal with grant application processes, have access to a lot of data, and that data is usually put into the grant application. But they usually have a lot more that wasn't included in an application that may help you. So if you're looking for any kind of data, find the grant writer. That'd be the first place. So look at those grant applications and talk to the person who developed the grant. Then you also want to talk about your agency level data. You got to remember, not only do you have the clients you work with and the clients your agency works with as a whole, but you also have investment data, return on investment. For example, how much did it cost to do Y? So now if you are looking for data, you have a return on investment approach because you know expenditures. Look at your local community prevention task force or coalition or other community organizations that form. Those are important pieces, and more importantly, important networks and linkages in your community. And then looking at partnering agencies and organizations. Definitely go to your partners and ask, hey, what data do you have about this? So you want to develop an inventory of what people have and also what they're willing to share. So it's one thing to have the data, it's another thing to share it. So you want to be sure that you talk to people and say, hey, do you have that data, and would you be willing to share it with us? And if you do, I would be willing to share this. So as you go back and forth through these processes, it's important that you keep an inventory. You will spend a lot of your time recreating the wheel and repetitively trying to remember who had what data if you don't develop the inventory. The next process is, where do we find it? We started already talking about the pieces of data that exist, like the Indiana Youth Survey. But again, you want to start local. Go to your local schools, go to the education department if they have reports, if the reports are online. You want to supplement where you don't have local data with more broad data, and that could be city level data, or that could be county level data, and it could also be state level data. But you want to make sure you use that data and national data sparingly. A lot of people, they can find national data sources, but if it's not specific to their city or their area, their identified targeted population, then one of the things that occurs in that process is that you really have diluted data. You're using countywide information that may not be consistent. And it's important to note that the uniqueness of your city may be totally unlike the rest of your county. There are, I'm sure some of you are aware, there are several grants out right now, Transforming School Climate Grant. There's a mental health grant for schools to partner with colleges and universities. So I get quite a few phone calls and emails on a daily basis these last couple of weeks about collecting data. And one of the things that occurs in this is that you want to get to that local source, and you want to avoid the county level. In one community, when we got them their county level data, they were significantly over 100% higher in terms of a rate of substance use than the county data indicated. And if they had just used the county data, they couldn't differentiate themselves as a part as being a higher need or lower need, or having more risk factors or less protective factors than the county. Because of the data, they were able to put in and show the reason why their community and their needs were higher than the county as a whole. Those are good uses of data. So start local and then supplement as needed. As we go through here then, we want to make sure that we look at data categorizations. And these data categorizations are things where, what kind of data should I collect? Well, we are all dealing with the health field, so are dealing with substance abuse and mental health, those kinds of issues generally in our community are social needs aspect of it. When we start looking at data, some of the highlights of that is we want health data, we're going to want student or youth data, we need crime and accident data. Of course, we need our demographics, and we need our laws and policies data. So as we move through here, we're going to walk through some of these step by step after we have a quick poll. But one of the things that's important to note is that you should have an inventory of where I get health data. You should have an inventory, or someone should maintain an inventory for you of where I get student data, who's the best place or where's the best place to get crime and accident data, where do I get demographic data, and where do I find laws and policies. A lot of cases this will already be collected for you in a community needs assessment, but not always. So what I'd like to do is start a poll. And that poll is from which of these categories have you collected data? Now you can select more than one in this poll, so select all that apply.
Wow, look at that. We have a lot of folks who are collecting data from a lot of different sources. I always expect to see student data pop up high, but look, we also have health and demographics popping up high. That's wonderful. Mm-hmm. And then there's a follow-up question there, which is, which of these have been the most challenging to collect? So of those ones that you have, and a lot of us have been involved in a lot of these data sources, what's been the biggest challenge? So take a minute to type in there as you're thinking about all the data you've collected, or maybe haven't been able to collect. So what was your biggest challenge and why?
It looks like we got several people typing, so that's a good sign too.
Mm-hmm. Overdose data has been challenging, Megan says. Absolutely, that has been, for a lot of communities, it's very difficult. Local law enforcement, data, arrests, absolutely, those are definitely ones that can be more challenging. Students collecting data on college campuses. Oh, okay, that's a subset of students that's specific. Students are overwhelmed and don't want to take the time. Absolutely, local student data. Interestingly, stigma on knowing the prevalence of the substance use disorders in the community. I understand that, and my community has a similar issues. Crime is often hard. Law enforcement agencies collect it differently. So true. Coroner data is difficult to get and often coded differently. Crime data, when you're looking for specific demographics, crime data can be really difficult. Rural community data, county level, but not that individual community level. When you get into smaller populations, those things become incredibly challenging. Absolutely. I know in my experience, collecting student data was always kind of the low-hanging fruit. We were always able to get that. But once we started to get into health, crime, and accident data, so it got really difficult. Had to think outside the box in a lot of ways. So city data, nonprofit data, hospital data is impossible to collect. It's so difficult. Hospital data is collected differently. It's hard to get at with confidentiality and privacy issues. I know where I live, we have about 6 different hospital systems that probably service our entire area, so it's incredibly challenging to get data from different places. Data that is not aggregated by population, behavioral data. Wow, you guys have had your fair share of challenges. But looking like you're doing a lot of work.
Mm-hmm. And I'm impressed that a lot of these, a lot of people know what their challenges are because they've tried, which is a sign that data, and they're using data effectively, and they're trying to get to make better decisions because they need more data. So that's always a positive.
Exactly. That's great. Good point.
And it looks like crime and accident data were the ones, even though all of them were high, it was at 59% and everything else was over 60 on our poll question. So that's interesting.
Yeah, absolutely. And in my experience, it's always been that crime and accident data is difficult. Health data, if you parse that out to hospitals, might get different results. But yeah, that a lot of people collecting that crime and accident data, but it can be really challenging, as pointed out.
All right.
Thanks, everyone, for participating and sharing with us. That's helpful. So let's keep going, Kyle. See what else you've got to share with us.
Well, and I found that interesting because it sheds light that that is somewhat consistent across what I see. And I guess in a weird way, I kind of do international evaluations now, but in the United States, it's definitely hard, as people say, to collect certain kinds of data. But I will tell you this, based on having done this for quite a number of years. One of my specializations, and I saw one of those responses that you read, Erin, were specific to rural. And rural is a challenge, but there are ways to get it. And so we'll talk a little bit about those processes as we move through, as well as crime data. So when we start talking about crime and accident data, there are a few kind of, and I'm sure everybody's tried it, but I will give you some of the tricks and trades that I've done, and we'll see if any of that is helpful as we go through this process. But as we move through then, one of the things that occurs is that we start moving then into our first part, which is health. Now almost everybody who mentioned health talked about some of the challenges of health. But let's talk about first and foremost where some of those opportunities exist. With health, we have health departments, and usually those are localized either to the county, in some cases to the city. So you definitely want to check the health departments out. Hospitals, as we mentioned, are difficult to get to, but there are some tricks to the trade there. Community coalitions and task forces are always good reference points, particularly those that deal with like MAD or SAD, that are going to have data specific to what you're trying to find in your community. Treatment providers, these can be for-profit and nonprofit. We can look at emergency medical services, the number of runs that they make, the number of times they use naloxone as an example, the number of services provided. Those all get coded. And so therefore, emergency medical services is one. And then as we mentioned in our poll question, particularly under some of the challenges, medical examiners or coroner's office. But there are a couple of things to note. First and foremost, when you're dealing with the health department, data exists. So when we're dealing about health, the data is there. It is a question of getting to the what we call, or what I call, the gatekeeper. And so one of the key phrases that if you haven't already learned, and I'm sure most of you have, is the gatekeeper. Now, if you're an Avengers fan or a Marvel comic fan, you know, the gatekeeper was Heimdall, and he was with Thor, and he was the one who controlled the bridge, and, you know, all the matter that transported people around. He was a gatekeeper, and his whole job was to make sure nothing came in that wasn't supposed to, and nothing left without permission. So a gatekeeper, by definition, in the health field is doing the same thing. And almost every gatekeeper is petrified by terms like HIPAA and FERPA and all these other protection pieces in place, rightfully so. But there are a couple of things to note. If the data exists and the data can be reported, then it can be de-identified. So just remember that. If the data exists, and the data can be reported, meaning it's not confidential like black box, national security issue, then it can be de-identified. And if you can talk that language to a lot of people in the health world, they will allow you to have de-identified data. Now, de-identified data doesn't mean I can't tell if it's male or female or ethnicity, but one of the things that occurs is you want to make sure that when you talk the health field, you learn the health language. So as we go through here, one of the things that occurs then is health departments and hospitals, they all use special coding processes. Hospitals, emergency medical services, in a lot of cases, use the same coding, and that coding usually comes out of Medicare and Medicaid billing practices. And the reason for that is a lot of reimbursement comes from those entities, so codes are usually defined in those volumes. And if you invest a little resources, we invested $65 to get a code book a couple of years ago, and we were able to ask specific hospitals and emergency medical services, we need all data that are all the times that you administered this code, or that you responded to a code of X, or that a hospital delivers services around these 5 codes. It makes the process of getting through that boundary, that gatekeeper, much easier. It allows you to communicate in the language of the health world, in the health departments and hospitals and emergency groups better. So as you go through there, be aware that if you learn their language, it is a lot of places like going to a foreign country. If you learn a little bit of their language, a lot more people are willing to help you out. The other thing I learned also is secretaries are usually your greatest gatekeepers, and if you can get in good with secretaries and get to know them, then usually that process of getting to data becomes much easier. Finally, don't forget the idea of leveraging. We had a rural community. We needed to get hospital data, particularly on overdose rates. The hospital was reluctant. The school district in the community, this rural community, was applying for a literacy grant, and that literacy grant was a book giveaway program. The hospital had a pediatric ward for newborns, and so we wrote the hospital in so that every newborn got a set of books, and then every time they came back to see the pediatrician, they got a new set of books to read at their house. And then that got us in with the administration, who then allowed us to have access to de-identified data. So as you go through the process, don't forget you're leveraging, and that there is usually a way to involve health because they have the same goal you do, which is to increase protective factors and reduce risk factors. We go through this process then as we talk about health as one piece. The other one is student data, and I think we have a great understanding about how to collect student level data, and that is through those student surveys, school districts, and Department of Ed. College campuses, there are some data that gets collected. Many universities have student surveys. They are somewhat, and depending on the university or college, have different times that they administer those surveys and in what strength they do them. But a lot of colleges now, if you're focusing on that age group, are using SBI RT, screening, brief intervention, and referral to treatment. One of the things that has to happen is every kid who goes through as a prevention program for SBI RT has to fill out a survey. They're de-identified, and so one of the things you can ask is to collect the de-identified surveys at the end of their events. So the kids aren't having to go through a separate process just to answer questions for you. They're already administering surveys related to alcohol use in particular, but now they're using other drugs as well. So learning, again, the language on the campus, how they're administered, and where to find that data. The other thing to remember about students is some cases we forget, but when we have students that leave high school, many of them don't go to college. In fact, right now, less than 50% or less than 40% of all adults in our world have a high school or a college diploma. So a lot of people don't go that college route. They may initially enroll and then move into something else. So you want to make sure you look for opportunities to address that population as well and not forget about them. That takes us then to crime and accident data. Now, again, a couple of things to note if you're struggling with crime and accident data. First and foremost, you have your local and state law enforcement. You have Department of Motor Vehicles, Department of Transportation, and the courts or the justice system. In most communities, in fact, every community, they have to report their data. So one of the things that you would want to look at is the FBI Crime Statistics Report. There are subsets that break down their data in a lot of cases all the way down to the department level. So if you have a city like a Houston that may have 4 or 5 different subparts of Houston that have different city police departments, you can find all 5 of those who report in, not to mention Houston Police Department. If you're in a rural community, usually that is going to be either a city police department or the county sheriff's office, and you can find the county sheriff's office data on that FBI Crime Statistics Report. So as you go through this process, do note that we move in. You can also get your information through the Department of Motor Vehicles and Department of Transportation. A lot of them have accident advisory groups, so you want to make sure that as you go through that process, you don't forget about them. In the state of Texas, as an example, where I'm from, we actually have a liaison to the local communities. There are only 6 in the entire state, but if you find that liaison, their job is to go out and investigate any fatal accident on the roadways in their area. And so as you go through that process, they collect that data, you can find that. Courts and justice system, usually they have to report, and there's usually an annual report. And that annual report then is something you can access, and they usually break it down by even all the way down to the local court system, including JP. Don't forget about your Juvenile Probation Services Department or Juvenile Probation Office Department. They also collect juvenile data, and again, if they collect it and it's publishable, then it can be de-identified, and you can de-identify all that data, and you can get arrest records by ethnicity, age, disability status in a lot of cases, depending on the jurisdictions that you're in. But that data is available, and generally they report up to the state that then as well will produce an annual report that breaks things down by at least the county level. But you can also get in, if you know the chief probation officer or the people within the probation department, break it down by zip code or even base it down by address. So crime and accident data is definitely an additional one. Demographics, we all are pretty familiar, and based on our survey poll, everybody pretty much knows where to go for government agencies. The state demographer's office, I have a personal relationship with the secretaries at about 10 different state demographer's offices. They're an exceptional group. If you haven't seen their work, go to a state demographer's report, and you'll get projections between now and 2030 in most cases of what your individual city is supposed to look like. Not to mention the U.S. Census, as well as school districts or state departments of education. And remember now, the U.S. Census for the last probably 15 years, in most cases, will break down your census data into your school district zones. So if you want specific information about school district data and changes to demographics, you can break it down and have it subset not just to your city, but compare your city to your district, and it will do that for you. So as you go through there, definitely some real good tools that are coming out from in regards to demographics. Laws and policy, again, all the state agencies that have any type of certification or licensing are places to go. That would include liquor licensing agencies, local county and state health departments, and other governmental agencies. If you have a governmental agency that you're dealing with, they have data. They collect it in multiple ways, particularly if they can issue citations or if they have to issue licenses. So if you get in that process, if they have the data and it can be reported, then it can be de-identified, which means it should be made available. So get to know those gatekeepers. So as we go through the process, then that takes us through the health and laws, and that gets us into managing data. And it's important that we understand that once you have all this data, what do we do with it? And one of the things that we want to make sure that we do is that we track it. And so one of the things that we want to do is secure it first and foremost. And if you have hard copy data, you want to make sure that you keep that under lock and key. If it's computer files, that you keep that under lock and key as well with encryption, and that only certain people have access to your data. You want to make sure that you have adequate storage space for your data, so you don't have data in files that are laying on the floor, particularly if you have in your office identifiable data, because that's you may be working in a counseling field and you're dealing with counseling records. But de-identified data as well needs to be locked just to maintain proper relationships with those who gave you the data, to make sure you know you're not just leaving it at Starbucks or leaving it at a Subway somewhere. And when you collect your data, it's important to maintain a catalog of all the data. For example, the type of data, the source of data, who gave you the data, the format the data is in, and then rate the data quality. If you've ever needed to write a report quickly and you are struggling to collect all your data, it is invaluable to have a catalog. And that catalog should have all these things listed in it. So that way, if you need to get an update of the hospital data, you already know who the boundary keeper is or the gatekeeper is, and you already have their name and you can contact them. You already know in what format it's going to come to you, CVS, Excel, PDF, Word, and then you can rate the quality of that data. It is important that when we start managing data that we start looking that we get the raw data that's de-identified, so we can have a denominator and a numerator, and we'll talk a little bit about that later. So as we go through the process, managing data is an essential element to data collection. If you're collecting data and you want to make data-informed decisions, so you have to make sure that you can access the data and that you can access it in a timely manner, and that you have the most current data. So a lot of cases, which is somewhat sad to see in a lot of cases. We get a lot of data sets that come in and they're still using pre-2010, 2012 data to describe their community. I can't imagine the changes most communities have experienced between 2008, 2010, and now. So make sure that you have the most updated type of data. I do anniversary kind of gifts to the gatekeepers and boundary scanners that I work with. Boundary scanner is just like a gatekeeper. And one of the things that occurs in that process is hey, it's been our 1 year since you gave me this data. I get one of those Evite that gets a card and, it has a little, celebration event on it, and it says, hey, it's in this year's data available now. So that way I can keep track of the data that I need. So as we go through the process, data management becomes essential. So once you have all this data and you start looking through this data, now you need to start assessing your data. And we start looking at this data assessment. And Erin, you did a great job on this. I still like that picture a lot because it hits exactly what we're looking for. Is you start mapping out your picture and you start trying to paint a narrative or a report or trying to describe to someone your community, and invariably we know we have gaps. And so as these gaps come across, one of the things that's important to note is how we fill those gaps. So one of the ways that we can fill gaps in data collection, as we mentioned earlier, was to use national data. We definitely want to use that sparingly. We can create and administer our own surveys, and that is an option. So as you go through that process, one of the things that you can always do is either with your own clients or standing outside of a Walmart like we've done on many occasions is to survey people coming in and out. You're looking for places where average community members would go. And so we're looking for events that are not just wouldn't go to a wine and cheese event unless the wine and cheese event was the target audience I was trying to get data from. We can conduct your own evaluations, so that way you have your own outcome data. And you can create a data team to address and fill in those gaps. And I know a lot of organizations are small, but remember your data team can also be your partners because you have a lot of partners as we talk about law enforcement, health department, health people in the health field. All of those kinds of people are a part of your data team, will be able to help you collect your data. So as we go through that process then, as we start talking about data, one of the things that's important to do is this is interactive. And one of the things that I want you to start thinking about is what data do you already have? What data do you know is missing? And how can you fill those gaps? And we already talked previously in our previous poll about some of the gaps and challenges. So what I'd like you to do is answer down at the bottom, type in what data do you already have, what data is missing, and how can you fill that gap? Erin, anything you'd like to add?
No, thanks, Kyle. Yeah, absolutely. I see people are already typing, so each box has a different question. If you can just see kind of my arrows that don't always line up as much as I think they are when I'm trying to be clever. But if you can just take a minute, and if you don't have data yet or you want to talk more about the gaps or what's missing, feel free to just take a second to type in there, and we'll see maybe we have some colleagues who have great answers. So like we saw in the poll earlier, we're already seeing that people have youth data, health data, demographics, youth vaping data. That's fantastic. So that was something we saw a lot in that poll about what data have you been collecting. And then, maybe we'll start to see those same correlations here with what's missing and where are the gaps. Youth and demographics and health data is a lot of that data. We have community norms data is missing for some folks. Community health center, hospital data, ER, specific content about student vapes. That's interesting about that, kind of getting at what are they using and what is it made of, and kind of breaking that down a little bit more. And modifying current survey questions is a way to fill the gap. So let's kind of keep giving our colleagues a chance to type in there. Data on how many people may be at risk of opioid addiction. That's one that you're missing. That can be a hard one to get a hold of. I see we do have someone who has coroner data, and I know that was a challenge I heard earlier, so any tips you have for how you fill the gap of coroner data, you can just type that in there. How can you, or maybe how did you fill that gap, if it was? Hospital and overdose data. Accurate county-level crime stats, absolutely, those can be very difficult. And if it's missing, what are you going to do about it? So, so also in those, how can you fill gaps, you can also type in there, how did you fill a gap? So if you had a gap and you filled it, on some of these that your colleagues are saying that they're missing, maybe what might those be? So Kyle, I'm seeing some really interesting responses to working with around how you can fill the gaps, working with hospitals to create a system to receive data. So how, just creating a process and a system by which that data can come in can sometimes help fill the gap. That's great. Working with local law enforcement to get the data is one way to kind of fill that, kind of building those relationships. We know with law enforcement can be incredibly important and impactful. Getting a code book speaking the language of the hospital, making from secretaries is always a great approach. For opioids, at-risk population, partner with a pharmacy and access how many long-acting scripts. Yeah, so you can look at also your prescription drug monitoring programs might have some of that data as well that you might be able to drill down. So who do you work with for that? Treatment data is missing for some folks. Just a few more people typing. This is great. You guys have done a lot and have thought really well about this. Establish key contacts. Relationships can be key and super important in data collection. Would you agree, Kyle?
Oh, absolutely. That's the best way to get data is to get to know who is the holder of that data and figure out a mutual way to leverage data.
Yeah, who's that Marvel Comics gatekeeper guy who can get you that data and what are his favorite kinds of donuts?
And I like
great.
The first one there about nicotine. If you need to, if we're having trouble finding nicotine content, change the survey or add to the survey.
Those are great. Cool. Well, thank you guys for taking the time to be thoughtful about this and sharing. And these things that we hear from each other can be helpful just to see that there are ways that people are already thinking about filling gaps that you might have, or it's okay that people are missing data and knowing that you're not alone in missing this data. And we'll also go back and look at this when we think about the second webinar that we'll have in a week, and we'll make sure that we're speaking to some of these same issues that you guys are struggling with. So Kyle, I'm going to turn it back over to you.
Sure. And I think that was an exceptional use of people's personal experiences and intellectual capital that everybody has doing this work, of how they were able to at least identify what their gaps were, what their gaps were, and what are some of the possible solutions. And several people gave us solutions that work for them. So one of those is never be afraid to modify a survey. So if you have a survey and you need to change and tweak that question, there's ways to do that. Even national surveys or state surveys that are valid and reliable generally will allow you to add questions at the end, to add your own personal questions at the end, and they'll score them for you. So as you go through that process, there's multiple ways of being able to better identify and collect data. The biggest ones, though, is to make sure that, as we mentioned and several people referenced, is to know who the keeper of the data is and become friends or at least relationships with those individuals. In a lot of cases, it's difficult, but like the hospital I referenced earlier, we've worked with police departments, particularly rural sheriff's departments. They are very difficult to work with because they're just so overwhelmed. They have so few staff. And one of the things that they'll tell you is, hey, I don't know why I need to give you this data. It's small numbers. Well, you got to remember, when you're dealing with rural communities, you report the raw number, but you also put it to a rate. And it is not uncommon when you're dealing with rural communities, if you can find the raw number and you put it to a rate per thousand, the rate of incidents happening in that community is actually higher than a lot of our urban settings. So, I deal in the urban work, and I understand the complexities there. Rural communities have a different challenge, and that is they may have 20 arrests for this or 20 episodes for opioid overdose, but when you put it to a rate per 1,000, those rates can actually be higher depending on the size of your rural community than even an inner city community. So never, ever get away from the idea that you need to get that raw data, but then be able to convert that to idea of ratio or a rate. So that's the first thing that we start thinking about when we deal with and concern ourselves with that data collection, and I really like that part of it. The other thing that we got to remember when we start looking at all these data sources is that a lot of places collect the data, they just never were used to sharing it because they don't see a benefit, what we call leveraging. So one of the ways that you can leverage it is, hey, if you give me your data, I will look for additional grant sources or grant opportunities specific to you or specific for you. And think about that. If you had been collecting and got the hospitals to be able to report to you de-identified opioid levels, right, opioid overdoses, or administrations of particular medications related to the overdose epidemic, then when all that money was released last year and actually is still being reviewed now at the federal level for new grant funds, you can imagine the hospital, the EMS, the police departments, and so forth would all be in a better position of qualifying and being able to use the data they gave you to leverage federal and state resources. So again, don't think about it as just asking for the data, but let them know about how you intend to use the data and what benefit it might be to the department. And over time, you will develop those positive relationships where they'll give you the data because this is what is tradition as long as it follows the rules of de-identification. So as we start the next piece and the last part, overall part of today's session, we're going to start talking about identifying and interpreting and analyzing data. Now, you can take college-level classes for years and still just kind of scratch the surface in all this. And so what we're going to do today is do the high-level overview. For those of you who are already invigorated by data, I hope this is exciting to you as it is me. If you already know it, it may be a quick review. But as we move through this process, we do want to make sure that we approach with everybody in mind about these pieces. In a lot of cases, we get kind of caught up in we start talking about evaluation. And the way I always kind of break that down is not to get too worried about a researcher versus a practitioner. Most people I work with in the field of prevention are practitioners. They do the work. They are out there. When I first started in prevention, I was a counselor. I didn't care about quantitative versus qualitative. Had no desire to worry about what those two were. What I needed to know is what did I have to keep confidential so I didn't get arrested, what was sensitive, and then what could I disclaim or make public. Those was it. So as a practitioner's point of view, I wanted to know what it is that I was going to get in trouble with, what it is I just kind of had to keep internally, and then what I could share with the world. And that became a kind of a forerunner for me throughout this entire process of knowing these differences. So as you go through this process, then one of the things to keep in mind is that researchers are going to look at quantitative and qualitative, practitioners, confidential, sensitive, and public. And so as you go through the process, everything that we collect has to pass the idea of ethics, morality, and law and data collection. Just remember, rules of conduct recognize the respect to a particular class of human action or a particular group of culture is our ethics. And so as you go through that process, we want to make sure that we're ethical, we're moral, and we abide by the law. Ethics, as you move through this process, is something that you're going to hear over and over again, and it is something that we have not always done well in our field. And so as you go through that process, it's important to note that we have some very infamous data collection scandals. The Landis one, if you aren't familiar with Landis's work on facial expressions, poor college students in the 1920s were asked to decapitate a live rat. And when they did, Landis recorded their facial expressions. When the participant refused to decapitate, then one of the things that occurred at that point in time is that he would do it in front of them himself and then record their facial expressions. So as you go through these processes, we've had even up into 2008 in the Major League Baseball Mitchell's report, incidences where we didn't follow ethics, morality, or even in some cases the law in how we collect data. So be aware that that is something that we always have to overcome. So you always have to be able to talk that what we're doing is ethical, it's moral, and it's legal. And that's why we use terms such as de-identify. So laws governing data collection, there's three primary ones. One is the HIPAA and HIPPA. Everybody should know it. We have the Family Educational Rights and Privacy Act and the Protection of Pupil Rights Amendment. These three individual rules or laws that impact the way we collect data. And when we collect data, one of the things that occurs with HIPAA is it is really just worried about personal health information or, including nowadays, personal identifiable information. So if you are an entity that is trying to be HIPAA compliant, what you're trying to make sure is that no personal health information that is identifiable is released. It applies to covered entities, legally it applies to covered entities who actually transmit to insurance claims, because that's where it started. So if you don't bill insurance, you really don't have to follow HIPAA, but it's a best practice. And HIPAA typically does not apply to prevention programs, right? So as you go through that process, you got to look at your own individual needs in your community, but you want to protect personal health information to make sure that somebody doesn't understand and can't come back that says Kyle or Kyle's kids has X, Y, and Z. Usually where you're going to get in trouble with HIPAA is Walmart. Somebody in your organization is going to turn around and be talking with a friend and say, hey, did you hear what happened to Kyle's kids or Kyle? Kyle has. And of course, somebody who knows Kyle or Kyle's going to be on the other aisle hearing all this. So that's what you're trying to prevent, is to make sure that you never link those two. De-identified data helps prevent that, so that no one ever knows what Kyle has. It's just a male of this age grade, of this age, of this ethnicity has X, so that there's no way to track it back. The other two, quickly, that we have to worry about, but not too much, is FERPA. FERPA is a protection for family data and family rights in regards to student-level data. And so as you go through these processes, it protects the privacy of the student. Good news there is it's usually some exemptions for evaluation work. When FERPA rules are implied, you just want to make sure that you have the written permission of parents or the student to release educational records. So if you're going through that process, you can speed that process up by getting parents or students to already sign off on it if they're of age of consent for the student, or get the parent. And then finally, we have PPRA. And the PPRA is one that probably has more impact on us if we do any student-level surveys using Department of Education funding, but it's the Protection of Pupil Rights Amendment, and it applies only if you receive Department of Education funding or the surveys being paid via Department of Education funding, U.S. Department of Ed. Be aware that in a lot of cases, federal pass-through money to states that do a surveys then follow up and have to comply with PPRA. And basically it says you have to do a consent before you're allowed to administer the surveys. Most people already do that, and there's 8 protected areas like income, health, political affiliation, that kind of thing. So as we go through those processes, that will take us then into kind of wrapping some of this up and putting a bow on it. And as we go through that, one of the things that Erin and I want to do is to make sure that we give you a homework assignment, but we want to do this a little bit different in that we want to be a resource as opposed to just a collector of your homework. And what we want you to do is identify the data you have, the data you need, and attempt to find one source of data for your program, where you might find it. And what I would like you to do, if you struggle with that, is to email us, and then we will report back what we think we can do or what resources there might be for you in regards to resources to track. But as you go through there between now and next Tuesday, and then we'll have a quick report out. Erin, anything I'm missing about the homework?
No, I think that's about right. Just spend some time really thinking about that, and email us really anything that comes up. You have my email address right there, and whether or not that is a question or kind of a statement or something of that nature, we can make sure we either address it with you right there in the spot, Kyle and I, or we can make sure that we get that information into our webinar next week. So if you could get that, kind of spend some time thinking about this in the next couple days and get that to us, that would be really fantastic, and hopefully we can really make sure that we're creating what you need as we go. And it looks like we have a question that I want to get to, and that is, we have a question from Janice that says, I was hoping to put a survey on Facebook to get insights on mental health and substance use of those 16 to 18-year-olds. What laws might I be breaking by using Facebook? I saw this as voluntary. Kyle, do you have any thoughts on what laws we might be in trouble with on Facebook? I can imagine there are some.
Well, the big one, the issue here is you're not going to be violating HIPAA or FERPA or PPRA, but so that takes care of the legal. But there's an ethical concern, right? So one of the things that we have in ethics is to make sure that we do right by all. And one of the things that we would have is when we start dealing with minors, which would be in different jurisdictions report minors differently. But the moment you start collecting from anyone, in my opinion, under the age of 18 is by rule a minor. You got to be careful that it could upset parents, particularly if kids report something. For example, let's say they report they have high suicidal ideation, and that's on your survey, but you don't report it back to the parent so they could do something and the kid winds up, let's say, unfortunately committing suicide. You get into all sorts of legal concerns in terms of who was responsible, who should have known. So I'd be very careful about a public platform unless the questions are straight kind of yes and no, or Likert scale that is truly de-identified. But you do run that risk anytime we start trying to do that 16, under 18 group.
Great, thank you.
One other
option. And then is there, go ahead.
Yeah, I was going to say one other thing might be is don't forget that if you're dealing with that age group, a lot of those kids wind up in after-school programs that have the ability to have de-identified surveys and those kind of things. Check to see if your local school has any type of after-school program to collect some of that data. But again, on a Facebook platform, you run into particularly the confluence of ethical.
Great, that's helpful insight, Kyle. Thank you. Also, I just wanted to ask Kyle, as like a follow-up, what do people need to think about in active versus passive consent environments? So I know there are some states that have passive consent, and then there are a few out there that still have active consent laws. Can you talk a little bit about what that means for surveys?
Sure. When you deal with active versus passive consent, what you're really looking at is, can this data ever be identified or can it ever be tracked back? So if you are administering a survey, even under PP, in some cases even under PPRA, one of the things that occurs is the question is it going to have any identifying information beyond basics like gender, grade, that kind of thing? If the answer there is no, there's no identifying information, and the school or the survey population is sufficient enough, usually 10 or more, of any subgroup, meaning that if Kyle is African American and 13 and in the 7th grade, and he's the only one in 7th grade that meets that criteria, then that is identifiable. So as long as there's a large grouping of all the subgroups, then you can usually use a passive consent. And the way that most people do that is they'll send a notice out to parents that says, hey, we're going to administer this survey. Here's a copy. If you don't want your child to participate, here's this consent. I want to send in a notice that says I do not want my child to participate. The other caveat there is that every kid gets the survey unless their parents tell them not to, even if they don't fill it out. Whereas the active consent is if you can identify it, then you need active consent and an assent. So if the child is under 18, they have to give assent to do it, even if their parent consents for them to take it.
Great. Thank you. Those are helpful distinctions. And I've been working in that for a long time, and those are still things that are good reminders and things that I forget. And we're just going to open up now. We have about 5 minutes of Kyle's time, and he is an absolute wealth of information. So any questions about anything we've covered today, any general questions you have about data collection or challenges that you'd like to ask Kyle at this time, feel free to type those in. You also may have a question that your peer has that they're maybe too shy to ask. So please take a second to type in those questions. We'll make sure that we get them to Kyle right now, and if we don't get to all of them, then we will take them into our next webinar and into email. But if you could just take a second to do that. And also, some of your peers may have great answers for you as well. So we are just going to take a minute. I have some folks typing in now.
And while they're typing, Erin, just to go back, just to kind of rephrase a little bit, is make sure that when we start dealing with ethics, your ethics apply to your professional relationships, morality applies to your interpersonal relationships, and law generally applies to society as a whole. So important distinctions there that most organizations, like prevention is a professional organization. Most of us have some type of certifications, that we have ethics that we have to apply with in addition to laws. Morality is a little different. Everybody, based on culture and background and nationality even, may have a different set of morality, whether or not, as an example, marriage, how many spouses you can have, how many you can't, is adultery moral or not. All those kinds of things are dependent upon usually culture and background.
Great. Those are good distinctions. And Janice, so you've mentioned a data catalog. Is there a template that you could share or that we can request or email and receive after the webinar for some sort of way to catalog your data?
Oh, sure. Yeah, I can definitely send or have available a template that I use as an example. It will change slightly based on the data source, but it has the basic ones. And it also tells me the link to my file, or I have it on my computer so I know how to find it easier. So yeah, I can send out a template. That
would be fantastic. Thank you. And Megan says that this has really reinforced that she's doing things correctly. And says thank you. And Megan, I'm so glad. And hopefully next week we'll continue to build on that and hopefully give you some new tips and tricks as well. Sarah asks, when working in small rural areas, sometimes using data can be identifying. So if you have a small population like Asian male 14 to 16 can be identifying. Absolutely, we've seen that. Any advice on working with small populations like 26 schools in an entire grade in a district? Ooh, that is small. Kyle?
Yeah, I think that at that point, one of the things that happens is if you collect that data, normally that if it's less than 10, if you have 10 or less, then you don't want to report it at all. So if you have 10 respondents, so therefore they don't have plausible deniability. My advice would be is if you have such a small student population, and assuming that the school grade has 100 or more students in it, that's 26% of the population. You're on that borderline of whether or not you need to use that data or do double asterisks and collect that into a different subgroup like minority children and just group everybody together. That might be the better way to do that as opposed to trying to break it out with such a small population. But what I have there is I have the numerator. I don't have the denominator of all students in the grade. So it's hard to tell just on face value, but it looks small to me just based on that number. And so therefore I would advise to be cautious and do what would be ethical, which is not report.
That's great. And
so collect it, see that you're small, and then not report.
Yeah, and I like the idea of saying let's find a different way to categorize that into a larger population. So minority students or male students, or expanding that age range to maybe 14 to 18 to see if you could get enough to report. That's a great idea. Okay, well, we are almost at the end of our time. We have maybe time for one or more questions, but I don't see any coming in at the moment. You guys have been just an absolutely fantastic audience and just provided so much wealth of information to each other and for us. So I want to thank you for that. And I want to thank Kyle for his time. I will look for emails from you guys for your homework. Air quotes for homework, but any questions that come up or anything as we get ready to go into our webinar next week, please feel free to send me those. You guys have been absolutely fantastic, so thank you, Kyle. And I will turn it over to Ann as we wrap up here.
I just was going to remind everyone again of the webinar on the 16th. This will certainly, all of this information will be a great segue into the second webinar, which I'm sure we will all learn a lot more from as well. So if you have any questions, you can let us know. I do see a quick question that says, will this webinar be recorded and available? And Veronica's answering that, but yes. not in the next 24 hours, but it will be available. And we can send out an email to people when it's ready so that they can go to it if they'd like to. But thank you, everyone, for attending. And thank you again, Kyle and Erin. And we hope to see you next week. Have a great afternoon, everyone.
Thanks, everyone. See you next week.